Prior to any anesthetic event or surgical procedure, there are important safety procedures to be performed to make the experience as smooth and safe as possible. At the Veterinary Emergency Service, we routinely screen surgical patients for systemic disease, dehydration, infection, or other problems with blood and urine tests. Depending on the nature of the anticipated procedure, radiographs of the heart and lungs, abdomen, injured limb, or other body parts may be required. Ultrasound examination of internal organs can also provide crucial clues to the anesthetist and surgeon about what to expect during the procedure. All patients undergoing anesthesia and surgery must have an intravenous catheter. These can be placed in the front limbs, hind limbs, or even the jugular veins of the neck in some cases. This provides the anesthetist with an easy route to give supportive fluid treatments, antibiotics, and even life-saving medications in the event of an emergency. What you see here is a typical intravenous catheter placement in the forelimb. This catheter can remain in place for up to a few days after the surgical procedure as a way to give pain control medication, antibiotics, or other necessary therapy. In some cases, a catheter can even be placed in an artery to directly monitor blood pressure, oxygen, and carbon dioxide levels. Prior to starting anesthesia, the equipment to be used is tested for safety and good function. Here you see Dr. Donna Quant, a board-certified veterinary anesthesiologist, checking one of our gas anesthesia delivery machines. Many of the same medications and techniques are used for veterinary and human anesthesia, including injectable narcotics for pain control and relaxation, rapid induction medications, gas anesthetic drugs, regional anesthetic administration such as an epidural injection, and occasionally paralytic drugs. Animals also benefit from the same intensive monitoring of vital signs, blood pressure, oxygenation, carbon dioxide, and cardiac activity. We will see more on anesthetic monitoring a bit later. After a dose of injectable anesthetic is given, a breathing tube is passed into the patient's airway to protect and control breathing. This lets our anesthesia staff measure exhaled carbon dioxide and prevents anesthetic gases from leaking into the environment and exposing the operating room personnel. Each patient must have a wide zone of fur clipped and prepped to create a sterile surgical field. Even though the planned incision is limited to a smaller area, having extra shaved and prepped skin can be very helpful for unanticipated problems, including difficult wound closure, placement of surgical drains, or placement of feeding tubes. Here you see a routine, wide preparation of the abdomen for surgery. Once the intended area is cleaned thoroughly, a sterile towel cover is applied, and the patient is moved to the operating room. With some of our larger patients, this is a big job requiring many hands.